remains unchanged with the new study cohort, which comprised 292 patients, 131 who received angioplasty prior to the advent of pre-hospital ECG, 161 cases after. In terms of statistical considerations, again, our primary endpoints was a comparison in the differences in median symptom balloon time, first medical contact balloon time, and door to balloon time between patients who received angioplasty prior to and following the availability of pre-hospital ECGs. Here are some of the important baseline characteristics. You will note that the patients were fairly well matched with no statistically significant differences in baseline characteristics. The overall age of our study cohort was 64 years, with a predominance of male gender. Roughly about half of the patients in our cohort had an anterior line, with less than 10% of them presenting frank cardiogenic shock. None of the differences, the baseline characteristics were statistically different. These are our initial main results. I'm going to start from the right-hand side. If you actually look at the traditional metric of reperfusion therapy, the traditional door-to-balloon time, which is defined as the door of first hospital registration at the PCI center, the patients who received primary angioplasty after the availability of pre-hospital ECG realized a 36-minute reduction in door-to-balloon time from 115 to 79 minutes. Using a more contemporary and we believe more appropriate measure of reperfusion therapy with the first medical contact balloon time, again, similar results are realized with a almost 30-minute reduction in first medical contact balloon time. Interestingly, if you actually look at symptom onset to balloon time, which by definition incorporates first medical contact balloon and door to balloon, there was a continued separation of these time points. And when we actually looked at this, the patients who had pre-hospital available at pre-hospital ECG did tend to contact EHS services earlier. We believe it's a play of chance, but it's something that needs to be explored further. If we continue now and break down reperfusion times by mode of patient transportation, 4 groups of patients can be identified. Those patients who were identified in the field of the pre-hospital ECG, those who presented to a hospital by EHS without pre-hospital ECG, those patients who actually walked into a PCI center, and those patients who were triaged in and transferred from a community hospital for primary angioplasty. As you can see, the group that had the shortest first medical contact to balloon time and door to balloon time were those who were identified in the field at 81 minutes. And where's my little 81 minutes,